just reminder, we're not going to share any sensitive information. We're just going to talk about, the general, how we can mitigate GBV. Oh, nice to see you, Irene. Afnan, are you raising your hand or are you saying hello?
Yes, just I want to ask if it is important to open or to turn on my camera because I am out of office.
You don't have to. It would be lovely to see you, but you don't have to at all. No, we understand that people don't have great connection in many of your locations. So no, not at all.
Okay, thank you.
But we can hear you well.
Okay, yes.
I think I will start by just introducing the Community Engagement Forum and the cluster and why we are organizing this session while we're still waiting for some people to join. And I would like to share my screen here. It's always nice with some visuals. Let's see now. Does that work for you? If you're not, Irene, I can see you. Can you see the screen?
Yes, it works.
Perfect, thanks. My name is Kristin, and I am the moderator for the Community Engagement Forum, and we're part of the CCCM cluster globally. We're a community of practice that focus on engaging the displaced and affected community in humanitarian response. One of the things that we do as this community of practice is sharing experiences and resources and challenges in order to come up with collective solutions among ourselves on how to address these challenges. So today we're co-facilitating this session together with the CCCM coordinators on addressing GBV and the role of CCCM coordination teams. So this is part of 16 days of activism against GBV, the campaign, the global campaign. For us, it's an incredibly important campaign, and using this every year as a space to continue to advocate for the safety of women and girls in displacement. So today in this session, in doing that, we want to highlight the role that CCCM actors should play in addressing GBV and our responsibilities. We want to explore the role of displaced community members in mitigating GBV risks. We want to hear from practitioners. So we've called in on a few experts for them to share their experiences and recommendations, and you will have the chance to also ask your questions to them. So we want to exchange as a group on their best practices and your best practices and our challenges and priorities. So with that, I want to hand over to first Dare Hayo and then to Clementine Favier, who are the Global CCCM cluster coordinators. I think I will stop sharing right now so we can see there first. Over to you.
Kristin, thank you. First of all, do you hear me? Please confirm. Do you hear me?
Yes, we do. Yes, we do.
Okay, all right. Well, thank you, colleagues. Good afternoon to all of you, and thank you very much for dedicating your time for this critical discussion, as has just been explained by our colleague Kristin. I also would like to thank the panelists and the colleagues for taking the time, and of course the Community Engagement Forum, Kristin, and the colleagues. It has always been useful, informative for all of us. It is very important activity that we are doing, and I think, as you mentioned, Kristin, this is a critical activity for the CCCM actors. regardless whether we are coordinators or practitioners or direct respondents. GBV is, throughout our work, has been proven to be a life-threatening issue. It has rooted in inequality, it heightened during the humanitarian emergencies wherever we operate. And I think sometimes it is an issue not just because of the problem itself, but also because of the fact that we don't dedicate enough time to recognize it and to acknowledge it. And that's why I think these kind of events and activities are essential reminders for all of us that this remains an issue that we have to address throughout our daily works. And there is no way, by no means, we should think that any day we have to stop about thinking on the impact of our activities and how we can better address gender-based violence. It is, of course, also a chronically underfunded in general. And I think we have to remind not only ourselves, but also the donors and all the contributors to the humanitarian work that this remains important. Once again, I think we have to first, as mentioned, we have to collectively acknowledge and recognize that this is an issue throughout the system. And we have to stand committed to advocate and champion a safer, more dignified space for women, girls in displacement settings from the beginning. Even when we discuss solutions, it remains equally essential and very important. Again, the catalytic role of the CCCM is there throughout our community engagement, throughout our management and interaction with communities. We have to keep reaffirming our shared commitment to building a humanitarian system that simply aims at putting this in the core of their activities and provide a better protection to uplift the capacities and efforts to address gender-based violence. Thank you. Back to you, Kirsten.
Thanks very much there. I'm going to hand over to Clementine.
Thanks, Der, and thanks, Christine. Maybe just building on what some of the points that Der mentioned. I think I wanted a bit more focused on CCCM and GBV, and I think it has now been recognized that CCCM actors have a key role to play in addressing GBV risk. I think a few years ago, earlier on the call to action, there was a lot of question on why CCCM practitioners had to get involved in gender-based violence. And I think now, which is very positive, the question is more about how we should engage in gender-based violence mitigation or risk mitigation. And I think it entails very concrete action that should be undertaken by CCCM practitioner. And I think something that is important to mention is that it's both at the cluster and at more operational level. And I think it's great that I see from the participant list that we both have cluster coordinators or cluster IMs, but also a CCCM practitioner at a more operational level. So I think, first of all, it was established that the responsibility of the CM practitioner in addressing GBV is first and foremost action related to GBV risk mitigation, which means reducing the risk of exposure to gender-based violence. And I think a lot of us consider this now, which I think is a very positive development, just good programming. And I think there are a lot of illustration of what do examples of this good programming. I won't necessarily go into too much detail because I think we'll get some examples from the panelists, but I think it first is do no harm. It's how we avoid creating or exacerbating risk of GBV in our own CCCM action. It is fostering the empowerment and participation of at-risk groups, notably women and girls. It's monitoring the safe access of at-risk group to services inside or in camps through a lot of the monitoring services that we have as a core responsibility. It is prioritizing safety and dignity of women and girls at all times, noting that this can take quite a lot of forms, and I think it would be quite interesting to hear from the panelists, but also from the members or the CCM practitioner online of example of that. I think it's also quite important to note that when it comes to response to GBV, specialized GBV actors are the one in the lead and responsible for it. It does not necessarily mean that as CCCM practitioner or coordinators, we don't have a role, because I think, for example, training the front light workers, notably the CCCM staff, on how do they handle safe GBV disclosure by potential survivors, I think it's quite key, and I think this is now being included in lots of our training packages. However, I think it's quite important that we reiterate that so that this message really is well understood by everyone, is that establishing specialized services, referral pathway, and the provision of support to survivors is the co-responsibility of specialized GBV actors and not necessarily a responsibility of CCCM. And I think that's a distinction that it's important to keep in mind as we have this discussion. Having said that, there are quite a lot of concrete actions that CCCM coordination team can take, and that goes from disaggregation of data by sex and age, engagement of at-risk groups, or also, working hand in hand with specialized protection actors, or also like the GBVAOR at country level, to design appropriate strategies. And I think we'll hear some more example of that. So I won't go into much more detail because I want to hand over quickly to you and to the panelists. I think maybe a last couple of points is that it's important to emphasize that a lot of these actions have been further detailed and included and mainstream in core CCCM resources, such as the Camp Management Toolkit, the CCCM Cluster Training Package. It's also very much underlining and mainstream in the minimum standard for camp management. And last but not least, at least that will be very familiar to our cluster coordinators, but the recent CCCM coordination toolkits also include a full section on cross-cutting issue, which includes gender-based violence. So I think we also would invite all practitioners to consult them and familiarize themselves with, if you are not already familiar. I think we'll go back to some of the existing resources at the end of the event, and I'm sure we'll be sharing all the link. So I guess wishing you all a fruitful discussion, and thanks again for participating. As I think some of us were mentioning earlier, we know the end of the year is an extremely busy period, but I think we are glad to see such a wide enthusiasm for the 16 days of Active Them campaign as part of the CCCM cluster. And of course, I didn't start with that, but thanks a lot to all of the colleagues that have been working very hard to make this campaign happen, both in the global team, both in the kind of support team, but also at country level. We have had a lot of good feedback from all of you and a lots of good examples to share. So thanks again, and yeah, happy discussion. Over to you, Christine.
Thanks so much, both there and Clementine. I think you both emphasized very well the importance that CCCM actors, their role that we have. So, like you were saying, we're going to focus a bit on how now, as we moved on from just why to how we can do this. So I want to start in Yemen with Afnan Al-Shawi, and please correct me if I'm not pronouncing your names correctly. So Afnan Al-Shawi is the CCCM and shelter officer for Polish humanitarian action in Yemen. I'm going to also introduce the other panelists while I have you here, actually. We have Aman Kuleilat. Is that correct?
Yes.
Okay, great. She's the site coordination lead in Lebanon for IOM. We have Irene Mugambwa. She's the CCCM shelter and NFI sector coordinator for IOM in Nigeria. And we have Olivia Mukanasu. Is that correct, Olivia?
It's correct.
Pardon?
It was perfect.
It was perfect. Amazing. So Olivia is the CCCM cluster coordination officer for UNHCR in Somalia. So these are 4 panelists today. So now, Afnan, I want to start with a question for you, if that's okay. I want to hear about what specific strategies frontline organizations in Yemen, like your organization, have used to effectively handle GBV in displacement settings. I know you have a few great examples.
Hello, everyone. I'm happy to join you for this session today. Actually, the main rules for the organizations in Yemen, we are focusing in the camp designs at the beginning because we believe that it has a major role in reducing the risks of GBV through several aspects like space distribution in the camps. So the camps should be like designed to have separate and safe areas for women and children. So that thing will like reduce the risks of assault, of being assaulted. Also to like have a good lighting in the camp design, so it provides adequate lighting throughout the camp, especially in common areas and roads, so they can be led to the facilities and help enhancing the safety and the and to reduce, we can say, the opportunities for violence. Also through the site designing, we can like facilitate the access to, for example, the toilets and the showers. So it must be closed and safe with privacy. Also facilitating health services and psychological support. Other things we can do also is to conduct awareness and training. We organize like workshops on human rights and awareness sessions of GBV risks, so the people in the sites can know what they can like face and how they can do. Also, we can like have the community participation activities, so we can involve the local community in designing the camps, so they feel they enhance the sense of safety and belonging to the sites. And I think finally of the camps design, we focus on the public spaces. So we create like public spaces used for social and educational purposes, which can like enhance the community interaction and to provide the mutual and therapy support. So this is basically a main thing we can do as a CCCM in the field to reduce the GBV issues. Shall I continue?
We can come back to you, Afnan, for more examples afterwards, because I want to also mention to all the participants here that after we've heard from the 4 contributors, we'll have a Q&A session. So maybe instead of having opening now for questions to each panelist, we can come back. But those, thank you for sharing these very practical and very clear examples, Afnan. And now I want to ask Aman, who is in Lebanon. I want to hear any of the key actions that you've taken to address these issues, maybe also focusing a bit on building safer and more dignified approaches for girls and women, if you have any of these examples.
Yeah, sure. Thanks, Kristen. Thanks for having me here. I'm very happy to join. If you allow me first to provide a very quick overview of the situation here in Lebanon, where we stand right now as a newly formed sector, following the recent escalation and increased instability in Lebanon due to the cross-border conflict between Israel and Hezbollah. That started since November 2023 and has triggered the full-scale war, as you've all seen. Late September, that has caused to more than 899,000 displaced all across the country and opening of more than 1,000 collective sites. hosting many displaced, not only Lebanese, but also Syrians, Palestinians, migrants, domestic workers that in some cases were denied access to shelters and also were not given equal access to services as other Lebanese displaced. In response to this escalation and the deteriorating humanitarian situation and increased needs, the site management and coordination sector was formed, and it was only 2 months here, 2 months, 2 months in age when the ceasefire agreement was reached in November 26, which led to the return of many of the IDPs who were displaced. However, some still remain in displacement because of their uncertainty about whether the ceasefire will hold or it will collapse, and also the destruction of shelters and homes that block them from returning back to their areas of origin. So as of now, we have reports indicating that over 800 IDP sites or collective sites have been closed, and the remaining is around 100 to 200 collective sites remaining open, and people are still in there. We have around 10,000 displaced still in these sites, requiring urgent and immediate support from our sector to respond to their needs. Now, as a result of all the situation, the site management and coordination sector was established, and one of our key priorities as sector coordinators, with the number of people displaced increasing and number of sites increasing before the ceasefire agreement was reached, was of course to ensure we have the quality data coming on registration. And when I say quality data, I'm referring to the point that Clem mentioned in her speech about data segregated by age and gender to inform gender-sensitive programming and tailor the assistance to the needs. So one of the very important step that we did, as coordinators, we engaged with the National Disaster Risk Management and with the Lebanese Red Cross was supporting with the registration to ensure that the registration process is safe and it is gender and sex segregated, and we have quality data and critical data that lay the foundation for gender-sensitive programming and enables identification of needs and vulnerabilities and addressing them in a timely manner. Another thing is that with the number of sites like increasing very rapidly, and also with the number of services provided in that sites, one of the key priority for us was to ensure that these services and assistance is monitored. And of course, this would not be done without a site monitoring tool or form that would enable systematic and regular monitoring of sectoral standards, including protection, GBV, and child protection sectoral indicators that would enable real-time data flowing from the sites and would enable also adjustments to any site designs or, for example, partitioners needs or lighting needs or any other GBV risk mitigation or protection risk mitigation activities or what do you call it? Basically activities, right? So, of course, this was done in joint coordination with the child protection and GBV sectors, in which extensive consultation sessions were conducted to come up with standard indicators that would enable us monitor these GBV standards regularly and enable modifications if needed to mitigate any potential risks that could take place in the future. Another thing that we also emphasized on was to ensure that our partners, frontliners, and also the government designated site focal points and also the community committees and affected population have the necessary knowledge and skills to first of all understand what are the protection risks and how can we mainstream protection in CCCM or site management and coordination, and also they are trained on safe identification and safe referral. They know how to map protection and GBV referral cases and how to safe identify and refer GBV cases in a sensitive and confidential manner. This was achieved through also consultation with the GBV and child protection and protection sectors to ensure that the CCCM modules or training packages that we have developed have integrated the GBV chapters and protection chapters that would address this information needs and increase the awareness and the knowledge on GBV and protection in general. This is all from my end. Over to you, Kristen.
Thank you so much. I have a lot of questions. There's a lot of interesting examples there that I would love to hear more details about. We'll come back to that though, and I'm sure others have questions as well. Thank you so much, Aman. I want to hand over to you now, Irene, and I think I have some pictures from your setting here, because you will be talking about a different aspect of both community engagement and GBV, the complaints and feedback mechanisms and the accessibility that women and girls can have to this. I'm going to hand over to you now, Irene.
Thank you very much, Christine, and good morning, good afternoon, everyone. Let me start by a small brief of the Nigerian context. We have about 2.2 million people displaced, more or less a similar number of returnees, about 1,500 camp or camp-like settings, and we respond to about 255 of these across 3 states of Nigeria, which is Borno, Yobe, and Adamawa. So in our quest to making sure that complaints are reported, because this was quite a big issue in Nigeria where culturally the community would sort of, I think, felt like they could handle their own issue. They didn't, it was not so open or very common for the displaced population to report their complaints, especially the SGBV or GBV ones. And there were quite a number that we could observe or you could hear from, the community leaders bringing to your attention, but they were never reported. So from the sector point of view, we collaborated with the AAP working group and I think some of the partners where we received a bit of funding under the Common Pool Fund to assess the community on their knowledge of the existing reporting mechanism or complaint mechanisms. So we sampled out a few locations where we had, for example, the closeness to the military locations, closeness to deep field locations where access was a bit difficult, and some locations that were quite open, porous in nature. People would come in and out. And so we wanted to find out and engage the population in terms of how knowledgeable they are in using the complaint-based mechanisms that we had on the ground. I think at the time, this was about 2 or 3 years, 3 years ago, because the conflict has lasted for about 14 years now. So it could have been like maybe 4 years, not 3 years, 4 years ago. So we tried to find out why we are not making much effort in terms of actually getting numbers of complaints. And we rolled out this mechanism to ask the population if they find the complaint mechanism on the ground safe, if to report to, or if there are any barriers or risks identified when they want to make a complaint. And actually the results of this assessment that we carried out was quite eye-opening, where we found out we generally asked the whole population, not just women and girls, but it was quite obvious that the women had a lot more to say in the situation. So we had separate groups of assessment with the consulting the women and girls, asking the same questions as like the general population, and we're asking them how friendly they found the mechanisms on the ground. So majority of them were saying, oh, for example, the pigeonholes where we put the complaints are too open. In the open, everyone would see that we are going to make a complaint, or like culturally we cannot do that because we want to solve this issue on our own, or there would be some kind of stigma related to this, and things very much embedded into their cultural norms, but also very much related into the site the site setup as well. And also these complaints ranged from the time of reporting. For example, we could get more, for example, during the rain season, period, vis-a-vis the normal other periods of time. So we sort of found out a lot of information, and then that helps us to see how we can then customize some of these complaint feedback mechanisms to fit what the feedback and the recommendations the women and girls were saying. So for some of them, we actually had to change. I know that some of our partners like NRC, they went for another option of having the toll-free line. We know that, for example, IOM went for the is it called radio or audio recording, where you can just record your voice and then you could be heard. The other element that we found that I think is also key for this discussion was the fact that the women felt like it was better to have a one-on-one reporting rather than going to an information desk if it is like CCM, because they felt like there's so many people there and everyone is reporting all sorts of things. They don't feel like they had that much. So they wanted to use like maybe the groups, the volunteers on the ground, where they could tell them a few things vis-a-vis the pigeonholes or vis-a-vis any of these other. So we found out a lot of information that we used when we came back. We used to then formulate and review our tools of reporting. We also embedded some of these in our SOPs regarding how the complaints and feedback mechanisms in the ground should take into consideration of the protection mainstreaming, but also the privacy in reporting, so that then it doesn't become a problem for example, for the people that were reporting. And the outcomes up to now actually still surprise us. Yes, we still have restrictions in terms of how many people can report because of the culture aspect, but there was a bit of improvement, especially when we added in the translation in the local languages of some of these tools. It made it very easy to understand, and and a few trainings that we carried out. So there was a bit of improvement that we continue to see to this day, and we appreciate that we went through this exercise. So the friendliness of these elements has improved. The fact that they feel much more inclined to reporting to a human over a particular CFM that is on the ground, that they feel that perhaps they won't get a reply to, and the fact that at least now they know where to go and how to go about it. They know the referral pathways, they know, so CCM does this, because at some point, maybe I forgot to mention, at some point we had CFMs that were for food, WFP, the food security sector, together with the ones of CCM back to back. So one is here and the next one is there. So they wouldn't tell the difference because they were together. So all that was walked through, and I think we're since then we're getting some amazing result as a result of what we did with this assessment and the result of it. Thank you very much.
Thanks so much, Irene. That's amazing that you managed to actually make these changes to the programming based on the feedback from the assessment from the displaced. There might be one more picture here. No, that was it from Nigeria. I'll stop sharing, and I want to hand over the word now to Olivia, who is based in Somalia, and you have used the safety audit tool to improve the safety of women and girls in displacement. So could you just please tell us a bit about that?
Yes, thank you so much for this question. So we're moving from one very good productive tool to the Somalia tool, which is the safety audit tool, which we actually rolled out almost 2.5 years ago in the context of Somalia. And I do really have to mention from the outset that this is a crucial collaborative initiative between the CCCM cluster and the CPGBV AORs. The tool was designed together with them. We've also consulted with the relevant, with the forcibly displaced, but I do have to admit from the very get-go that our consultations with the forcibly displaced populations could have been better. So actually, as a follow-up to today's session, we're going to really ensure to consult to a greater extent than what we've done till now. So I mentioned it's a tool designed jointly with the CPGBV AOR. And I think it's also important to emphasize that through the safety audits, the CCCM actually is really ensuring mainstreaming of protection, which is essential, obviously, in any context with forcibly displaced people. I also have to I would like to add just a few details about the context in Somalia. We have 3.5 million displaced people. Almost half of them are women and girls, and I think this is critical information for you to know about. And they are all living in so-called self-settled, right, self-identified locations. Those aren't formal camps as you know them from other contexts. Those are self-settled locations. There's no formal, camp structure. And this requires indeed a different approach in CCCM, also in terms of how we audit the sites to ensure the safety and security of the people, of the residents living there. Of course, the sites in Somalia are mostly, concentrated in major districts in various states in Somalia. But the largest, population is in Mogadishu, in the Benadir area and in the Baidoa area. I'm not going to spend more time on these, but it's also critical for you to understand that in all these 3,700 settled sites, approximately 85% of the shelter, for example, is makeshift shelter, and that in itself, it gives you an idea about the living conditions, right, in Somalia's sites. I don't think I need to spend a lot of time on the purpose of the safety audits, but since I do not know exactly who's part of the auditorium today, I really think it's important to mention that the safety audits in the context of CCCM and again, jointly with the CPGBVOR, those safety audits support us determining and observing risks and assess the specific vulnerabilities of women and girls. And I think what's critical here is for the purposes of identifying necessary actions, right, to reduce these risks and also strengthen, community ownership over site settlement infrastructure. So the audits evaluate the protection and gender-based violence risks associated with the settlement layout, the infrastructure, the shelter conditions, and service accessibility. As part of the safety audits in Somalia, I think this is interesting for you to observe. We are conducting the key informant interviews, but which are complemented by separate focus group discussions, giving, women and girls the opportunity to voice their concerns and suggest, and this is the keyword, critical improvements that they want to advance their safety and security. And ultimately minimize these GBV risks in the communities, right? So the methodology, and again, this is specifically for Somalia, the methodology of the safety audit tool in Somalia is specifically designed to be female-led. So in all our exercises when we conduct safety audits, and again, keep in mind the context of Somalia, I think 90% of the working force is male, right? We have a lot of men colleagues. In all the meetings, you would see 90 men and maybe 3 women. But despite this, we have this prerequisite and this, we cannot make it mandatory, right? Because we need to take in consideration the context of Somalia, but we strongly urge and recommend all the staff on the ground to make sure that the exercises are done by female staff members, or both in when they conduct the observations, right, and the focus group discussions and the key informant interviews. I have to share with you some numbers. CCCM Somalia conducted in 2023 702 safety audits in 26 districts across Somalia. This year in 2024, because we got a bit of resources and just a few extra partners, but very dedicated partners, we've conducted 1,742 safety audits. Both, like I cannot break it now in percentages, but it's both key informant interviews and the focus group discussions. And we've increased from 26 to 29 districts. And the difference this year is as follows. Last year, it was solely CCCM teams who conducted the exercise because we are the only ones with the resources. But this year, the teams was like a joint team with CCCM experts and CPGBV AOR experts, partners. In terms of the findings from the 2023 are pretty much identical with the findings in 2024. And I do have to say that for, I mean, in particular, we're going to discuss about 2025 agenda as well, which is going to make sure that we're going to be able to measure progress. So for example, if last year we've audited 50 sites in Benadir, right? When we do the safety audits in 2025, we're going to again do some safety auditing, at least 10-15% in Benadir, just to measure progress. Because after each time we do a safety audit, we always strive and advocate and need to get the necessary resources, you know, to go back and implement whatever the people, the women and girls have requested us to implement, you know, because otherwise we're just reaching, you know, survey fatigue and no impact in terms of advancing the rights and improving the living conditions of the forcibly displaced. The key findings is that public lighting remains a major concern across IDP sites. And I've observed this tendency across, you know, CCCM, you know, not only in Somalia, but in other locations as well. There's a tendency from the donors, you know, to fund soft activities, but in terms of the hard component, like improving infrastructure, having lighting initiatives, the funding is not necessarily there. So the majority of the sites, the informal settlements lack lighting. However, this year, further to our safety audits, we've managed to have at least, I think it's, if I'm not mistaken, we're still going to have to wait for the final data. We had at least 50 interventions, right? Not 50 lights, but 50 interventions across Somalia. And usually in one location, if you manage to install roughly 50 lights, you know, the lighting stops, that would improve conditions for at least 50, 60, up to 100,000 residents there. Shelter, again, as a finding, and we already know, as I said, it's makeshift shelter. Most of the structures lack, you know, the basic security features. And this leads us, right, we use the data from the safety audit to tailor, to craft advocacy notes in order to advocate for more increase in funding for shelter interventions. Another critical gap in Somalia is the fact that most of the sites lack proper spaces for women, girls, and children, right? There hasn't been enough or sufficient funding to have these designated places, and there is a tendency in Somalia, you know, given the context, the cultural barriers and religious barriers, right, to have these facilities specifically tailored to the needs of women and girls. And again, a huge important thing for everybody to know that it's not enough just to advocate for the lighting, for the hard component activities. In the context of Somalia, this goes hand in hand with the CCCM due diligence, the HLP. Everything we install in all these locations, being a community center, being lighting, whenever we place the facilities, we need to ensure that they're placed on public land. So everything we do comes in strict coordination, you know, with the government authorities and all the partners to ensure that whatever interventions we have remain there, are sustainable. Another piece of information maybe is to say that the safety audit findings that we have, when we assess, you know, the risks, when we do the advocacy, we also look at these results in combination with the CCCM rapid gender assessments, and the findings in both sets of assessments coincide. I mean, it's the same finding, and in order for us to be able to immediately redress these physical safety concerns, of course, we need a bit of more funding. I know there are no donors here, but it's just to highlight the fact that
we can share
such a critical job we do, and yet we are underfunded when we can achieve so much with fairly little. To conclude, and then
Wednesday.
in the same line as has started, the safety audits done by CCCM and partners are not just assessments, they are catalysts for action. They provide the evidence base needed for targeted interventions and help ensure that our humanitarian response addresses the real needs of the people we serve. Thank you so much.
Thank you. That was great advocacy point for more funding for safety audits and for GBV mitigation in general. Thank you all for panelists. I do, of course, have a million questions, but I'm going to open the floor for the rest of you. If you have any questions for Afnan or Aman, Irene or Olivia, you can raise your hand or just unmute yourself and ask. I can't see any hands. Agnes, yes, please.
Thank you. Yeah, I can come first. I see more hands now. But no, thank you to all the panelists. That was really interesting and so good to see all these efforts conducted by CCCM teams and having a real impact. So really good to hear from you about this important topic. One question, I would have several, but I will start with one. Maybe one question for Irene, because it was very interesting also to hear about complaint and feedback mechanisms. And I think that you touch upon very important topics, and there were like different levels of issues in the one that you spotted in Nigeria. And there was on one side the issue of accessibility of complaint and feedback mechanisms by women, the problem of where it is located, how it is handled, like you were looking for more human ways to create more trust and build this trust with women so that they can use the CFMs. And then there were also the issue of sensitive complaints that they were also probably willing to share. So these two aspects are very important, making sure that CFMs for any complaints are indeed also accessible to women and girls, and they feel comfortable in accessing and using them. And also then the issue of sensitive complaints, and how do you handle these sensitive complaints from a CCM perspective? Do you have SOPs or mechanisms in country to refer these sensitive complaints to GBV specialized actors? Or how do you work with them for this type of complaints that you may also receive in your operations? If you could please further explain, it would be really interesting. Thank you.
Thank you, Christine. Should I go and answer first? Okay. So thank you, Agnes. Yes, there are existing SOPs that actually we have to routinely review because situations keeps changing. But apart from that, we are working very, very closely with the GBV subsector or AOR and also with the PSA, because some of the two at the field level, they may not be able to distinguish the two, especially when it's about, for example, a staff who is also an IDP, for example. So a staff who is an IDP in that same location probably meets a lady or a girl and may feel like, they could have something, and yet according to us, it could be something else. So it's on the borderline of, PSA and GBV. So we work together with that, with the two entities, and we've got numerous back and forth discussions with the two agencies, non-agencies, working groups on training the CCM to identify the sensitivity of the issue and the referral mechanism, where we're like, okay, so because you're trusted at CCM does not mean you should be able to dive into the whole 9 yards of the issue. Make sure that these are the steps you're taking and it ends up with the right channel. So yes, that we are handling, and the situation evolves due to the SOPs and the referral pathways as deemed fit for the different changing elements.
Thanks, Irene. Thanks, Agnes. That's a very good question that I'm sure is relevant for all the contexts that we operate in. Jennifer, you have a question.
So hi everyone, and thanks for the really great presentation and the examples that you've shared. And I'm reflecting on some feedback that was given recently, was that, you know, a lot of this guidance kind of exists at global level or at cluster coordinator level, and I see, you know, kind of the good work of international NGOs. And considering that we're sitting in the you know, community space, you know, thinking about how the displaced communities themselves are that's the theme of this coffee chat. I'm wondering how you can think about how we can really transfer those skills down or transfer these actions back to the communities themselves. So I'm wondering if you have any reflection that we don't just keep this at high level at kind of organizational or cluster coordinator responsibilities, but how do we get it, you know, several levels down? It's an open question, so thanks.
I don't know if any of you would like to answer this, but I know that, not to put you on the spot, Afnan, but you were talking before about how you were working with female representatives from the displaced communities in Yemen. So that could maybe be a good example of this.
Hi, Kristen. Just sorry, I didn't get your point. If you could like clarify it more.
Jennifer, could you just ask the question again, please?
Sure. So my question is, how can we make sure that the actions that are being taken by the cluster coordinators or by the international organizations are actually transferred to the communities themselves so that they can put in place GBV risk mitigation on their own? Or what would be your reflection about kind of transference of good practice to communities themselves? Over.
Okay. As I understand your question, you mean just how can we make sure that we are like following the right steps to deal with GBV risks with the people? Am I right? Just could you correct?
I think you can also talk about how you work with the female representatives from the community directly in your GBV mitigation work.
Okay. With the actually with the female community committees in the sites, we are trying to conduct the awareness on the GBV risks, so we can explain for them what are the risks that the children in the society or in the site might face. So they can also make awareness by themselves to the people, and by them we can know if there is any GBV risks in the site, and then we can deal with that by referring them to the protection partner, to the specialist partner for this thing. I hope that I could understand your question.
I think that was perfect, Afnan. Thank you. Did you, Agnes, did you want to add anything, or will we see if anyone?
I would be pleased to add something else, but I see that Olivia has her hand up. As a panelist, I will let her the priority. So Olivia, please go ahead.
It's just
I'll
very
come
brief.
next.
In the context of Somalia, with the informal settlements we have, and the only thing we need actually is just a little space dedicated for the women, because their voices are overlooked in general. I'm not going to use percentage here, 90%, 100%, but just having a little dedicated space in a sea of, makeshift shelter where they can meet. And but the structures that we have, I can't quantify right now, but these specifically, designed small centers, which can accommodate up to 50, 100 women, they just go there, right? When they have 1-2 hours during the day, they go there. They even do some plastic knitting. They work a bit together and they talk together. And just by having a small dedicated place for them to meet, interact, and for us to be there just to listen in, there's a lot of information that comes out. And it's just women, you know, because it's pretty segregated. And there's a lot of ideas and recommendations that we can get from these places. But as I've explained, in terms of the hard component, we are still struggling. Thank you.
Thank you, Olivia, for your very practical examples. Aman, would you like to add to this?
Yes, thank you. Yeah, I just want to say that maybe building on the capacity building that we do for IDP site community committees, and instead of this being one-way information transfer from us to them on what are GBV risks, what are GBV standards, we could also look at more practical sessions, including more engagement from the affected communities, from the women, from the adolescent girls, from vulnerable populations, and safety audits and more consultation sessions, because there are a lot of risks that or risk triggers that they know but we don't know. Given that they live in the site 24/7, they could easily identify these risks to us more than we can do based on our very limited time we spend in the site. So I would say more engagement, more promote more participation of community participation in all the actions that we do, even in site monitoring. When we explain for them what is the standard, they should also be able to enable monitoring of standards themselves through the support of the site communities. Over.
That's such a good point, Aman. Thank you so much for raising this. Henry and then Agnes.
Hi, Christine. Actually, just to add to what Aman said, I also believe we need to have some targeted awareness raising and advocacy and engagement to duty bearers. I've had instances where people say, okay, we report this witness, where in societies where there are no social justice, where the law of the land is not really empowering, it's difficult to seek justice, talk about GBV. We've had instances in Sudan where the women say, why do you want to know about GBV? You can't even help, because what would you do? You raise awareness, what next? So it's difficult in terms of we need to target key stakeholders like local authorities, change of policies, which are really a more long-term project. We talk about GBV every year. We try to raise capacity of the beneficiaries who are oftentimes the victims. But where in contexts where there's no social justice, the duty bearers are not really empowered or willing to enforce the rights of women, it's difficult for women. They do understand the society they live in better than all of us. So it's difficult to really increase this awareness in this regard. Thank you.
Thanks, Henry. That's an extremely important point, and I'm sure it's been problematic for many of the people working in the different contexts. Agnes, do you want to add something or ask a question?
Yes, no, thank you. And maybe just to, it's a question to our panelists and building on the question from Jen also, because the engagement of the science sector when it comes to participation of women and girls, involvement in women's group has always been like critical, and we have advanced a lot in the sector on this. But I was wondering, because this is a question that we see more and more, and an interest that we see more and more, and a way of working that we also see more and more, is with the engagement of women's led organization, women's rights organization, including as cluster partners who can be like real light in our overall objective, to provide assistance, protect the people, and engage with women and girls. And some of them who engage on GBV risk mitigation can also be essential partners. So I was just wondering and asking to you as panelists, like at your level, do you have partnership with women's led organization where you work? Yes, no, and why? And if yes, like if you can tell us a bit more. What's the partnership about and what it entails? Thank you.
Do we have any volunteers to answer first?
We do
Well, I
have
can just-
women-led organ. Sorry.
I can
Sorry,
just say for the context of Somalia, the CCCM, I think, if I recall correctly, I think we have this year alone 10 requests from women-led organizations, including some human rights women-led organizations, to join the CCCM cluster. The thing is, of course, they can join. We have the regular forms, and they fill in the forms and they join. But for some reason, women-led organizations do not get the funding. They are not, pre-approved, but for the SHF fund, and they're also having almost no funding. And for Somalia, and this is a thing actually we can even take up in the next meeting with the HCHCT and the ICCG. In the context of Somalia, you really need to operate with a sort of quota. We have localization, roughly 80% of the organizations, right, are local, but among those, there is no single women-led organization, which kind of tells you of the need to have some stringent rules on what sort of organizations, right, you should prioritize for funding. And they should be capacitated. We have accepted them in the cluster, but then again, when you don't have the resources to carry out the work, right, they can be observers, but in terms of making the difference, it's difficult for them. And this is also a priority for our agencies. I know that both for IOM, UNHCR, and everybody else probably most likely sitting in this room. Thank you so much.
Thanks, Olivia. Aman, do you want to jump in here?
Yeah, I was going to say that, yes, we do have women-led organizations, but they are not necessarily site management and coordination partners. However, I'm just in the front of the LHF prioritization for the second reserve allocation, in which LHF, the Lebanese Humanitarian Fund team, have announced some flexible measures that would enable grassroots organizations and community-based organizations, including women-led organizations, to apply even if they are not eligible partners of LHF, through recommendation from the sector, which is good. And I was just looking at the list, and I identify a few women-led organizations. So it's an opportunity for us, and we will continue to advocate for inclusion of more local NGOs, including women-led organizations.
Yeah, that's a great example for what can be done elsewhere. Be a bit more flexible with them who can be approved for funding. I don't know, Irene, if you want to add anything about Nigeria situation here.
Yes. Maybe let me start from Jennifer's question. I was thinking, as you know, as the rest of the team were going on. So there's something that I think it is slowly picking up, but that is what they call the girl talk. I don't know if it is anywhere in any of the missions, but I think there is GBV, some of the GBV all protection partners encourage the girl talk at the very site level, where just like you and me, girl to girl, we can talk and have discussions just to talk about our issues. So instead of looking at, tackling some of these things at a very institutional level, we could encourage these girl-to-girl talks. We could have information packages where they can pick it up, for example, from the information desk of CCM, animated to be exact, where they don't have to read a lot of narratives, but then it's just something to guide them along the way in seeing that this information is passed on at the community level and specifically to every girl, child, or every woman. And when it comes to the women-led organizations, we have actually a number of them here in Nigeria, same as Somalia. They're not funded, they're not yet eligible for funding. But what we're encouraging now is to attach them to already existing NGOs or INGOs or UN, so that then they can be like implementing partners, just to start them off, because most of them are just coming up anew. And then in Nigeria, I think the HCT decided that 10% of all the NHF funding that is coming in will be going to local NGOs, and these local NGOs will also include the women-led organizations. So that is something that has motivated them quite a lot. And now they have created a number of forums or consortiums. So it's not just one women-led organizations. They're having several women-led organizations creating consortiums, going sector by sector, advocating for them to be included in the funding windows or in the response or in joining the sectors. And I think this is relatively newish, but I think it could work because we see that they're willing and motivated to carry on this way. Thank you.
Thanks so much. This Girl Talk, is it a GBV or CCCM cluster initiative?
It's where I've seen it is been GBV. We have not done it here yet, but it is something we can look into doing, in the future, probably. Yeah.
Thank you. Afnan, you're raising your hand.
Yeah, sorry, Kristen, just I gotta go to another meeting. It's urgent meeting, so can I now?
No problem. Thank you so much for joining us and for all your very useful input. Really appreciate it.
Okay, thank you guys. Have a nice day.
Bye. Do we have any more questions or comments from the group? I can't see any hands. I think we have a lot of points to summarize. I'm gonna, yes, Agnes.
I'm taking this opportunity because it's an amazing opportunity to be all here and to have time to discuss that. So it's really out of curiosity, but also to hear from the panelists, like if you have any or challenge or recommendation or any key message to share also about this work, the importance of this work or the impact that you see, or any final remark from you, indeed, before moving to the closure of this webinar. It would be really interesting to get your insight. So over to you.
Who would like to start? Aman, would you like to start with any recommendations?
Yeah, maybe just to say that as a site management and coordination sector, not structure, as a newly activated sector in the context of Lebanon, of course, we don't operate in silos. We operate very closely with other sectors, including with the protection, GBV subsector, and child protection, with shelter and others. As such, we always advocate for multi-sectoral approaches, and that protection and GBV are at the center of any site management and coordination response in addressing GBV and addressing identifying mitigation and GBV risks at the site level. As we continue to strengthen the sector, we also continue to collaborate very closely with the and GBV subsectors. Including, as I mentioned, as we move forward with more nationwide capacity, like establishing of nationwide capacity building strategy that would not only enable information and knowledge transfer for CCCM actors, but also for frontliners from the government and from the community themselves, to ensure there are proper messaging, IEC materials, trainings, information sessions, awareness campaigns, and information packages for community tailored to their language needs and to their language barriers that they could make use of, and also could stay as an asset for the government once this operation ends and we leave. So it's still in there. This is all from me. Over.
Great, thank you. Olivia, do you have any recommendations in addition to more funding for safety audits?
Yeah, I think we need to, in terms of a recommendation, I mean, everything is going to be about money, but in terms of us and how to capitalize on all the work we do. So I think every year, maybe when we have this, 16 days of activism and related events to GBV, maybe we can issue, just a one-pager with voices of women and girls supported by CCCM through our specific GBV work, and just I don't know, give it a bit more visibility, because it drowns among all other issues that we deal with. And yeah, we know that GBV is on the a priority for everyone. So I'm just thinking how to become more structured, at both global level and at national level, to bring more visibility to the work we do as CCCM, right? And as I said, in the context of Somalia, it is CCCM that's the driver and the initiative taker, and bringing together all the others around these issues. And it's because we have the biggest footprint here compared to the others. If I was to think specifically of the CP, GBV, AOR, right? No, I would like to reflect on this and gather my thoughts, but if we
You can always reach out.
Yes,
yeah.
absolutely. Yeah.
You can reach out to Agnes with more recommendations afterwards,
Absolutely.
of course.
Yes, thank you.
Irene, would you like to add anything from your contact?
Thank you. I think for me, the panel here today has showed us exactly what we do when it comes to GBV, from the CFMs to the safe audits to the site planning. I think there's a very big element of protection mainstreaming, GBV mainstreaming in our work, and it's not very much pronounced when it comes to CCM. I mean, the one thing this the GBV will ask, so what have you got to do with GBV? We are the GBV, and yet our work is almost closely. Everything that we do is to support the GBV, or at least lead the IDPs to make sure, or refugees to make sure that they are safe in this direction. So I don't think it should even be separated from what we do. Like, for example, our sector, we from time to time when we got funding, we put a line, like when we're advocating, we put, okay, so protection mainstreaming or GBV mainstreaming will get 10% of the funding that we're going to get for CCM, for example. So that then we push this kind of narrative that it's not separate. It is what we do to make sure that the people are safe. It's part of our safety mandate. Thank you.
Thanks very much, Irene. We do absolutely have a safety mandate, so thanks for reiterating that. Agnes, I'm going to hand back to you now to close the session. I'll share my screen.
Sure, I can even do without screen. That's okay. We're among us. That's okay. And Clémentine, please feel free to come in, but just a few words. Maybe I'll give you the floor right after, and then I'll make a few announcements, and including on social medias when it comes to visibility. Olivia, point very well taken, and we need to do more. But so just before that, no, thank you very much, and just reflecting on what you just said. And Irene, about the issue of proportional funding is also very important, and that's something that has been piloted in several countries. Indeed, to set aside a percentage of the budgets for the integration of cross-cutting issues, including GBV risk mitigation. Some countries put 3%, the percentage that they can, but this is a very good recommendation and something that has been tested and is working well, not only within our agencies or sectors, but also in other agencies and sectors. And that's something that's probably also a good way forward, as the funding may shrink also in the next years. So no, thank you very much to all the panelists. Indeed, we've heard a lot of things from you, and it's really interesting to see like all the work done and across the years. I mean, GBV has always been something that the CCM sector has taken seriously. If you remember the camp management toolkit, already in its old version, we already had a full chapter on GBV. So it's not something that the sector has discovered recently. But that's true that over the past like 10 years, with this call to action against GBV and say from the start support from a lot of us, it really allows us to structure a bit more our response, to develop more systematized way to mitigate the risk and really to embed that in all of our actions. So as Clem was saying in her introduction remark, yes, now it's not questioning why we do it. It's more like, okay, discussing on how we can do it better, what are the new approaches, the new trends, what can we do as CCCM, and how can we do it. So one thing that we touched upon during the question is also indeed really now the work of also the local partners in the frame of course, the localization efforts, but also more broadly our partnership with local organizations, including local women's-led organizations. That is an area that we do really encourage. And there are a lot of resources that exist also. So we mentioned the camp management toolkit. Clem, in her introductory remarks, mentioned also the new coordinator toolkit for CCCM, coordination toolkit. There's a full section on GBV risk mitigation with further guidance. There is also the minimum standards for camp management, where GBV risk mitigation has been mainstream throughout. For those of you who took the cluster training package, you know that it's also in there. So, and also invite you to consult the website of the GBV guidelines, which is unfortunately currently under maintenance, so we cannot share the link with you. But there's the ISC GBV guidelines group has a website which includes a lot of information, training material, resources that we can also use in our daily work to further mainstream GBV risk mitigation. I'll stop here, Clem, and I'll just have one word at the end on the social media campaign.
No, thanks, Agnes, and thanks, colleagues, and first thanks to Christine and to the panelists for making time, and for also, I think, illustrating a lot of the. I think it's quite positive, and I kind of end up the event with a big smile because I think such a long way has been done. You know, I think like from. And I think it was quite a good representation of the work we do. And I won't go back, you know, from CFM to Amani, what you were referring in terms of more like data collection to, you know, Irene, I think was quite interesting, this idea of really starting from kind of a consultation process to really try to understand from a more cultural perspective what, you know, how what we are doing is perceived and how can we improve it from the community perspective, which I think goes back to Jennifer's a bit question to also trying to, you know, have more of a people-centered kind of approach to risk mitigation. So I think it's quite positive. I was also, and I'm glad Agnes asked on also, because I think obviously when we ask about, you know, good examples, we from your presentation, we did not necessarily, you had not highlighted, and it's understanding, you know, what are some of the challenges. But I think it's quite interesting to also be all aware of what are the challenges, and some are very country specific, some are much more kind of, you know, obviously the funding, you know, and a lot of competing priorities, both from a coordination perspective, but also for those colleagues that work in quite difficult working environment. So I think it's also good that we're able to discuss those, because I think this will inform all of our work, both from the global team, but also, you know, at country level, what cluster coordinators can work on. So again, I think I don't want to speak too much, but I think it's been very useful, and I think I can speak on behalf of all of the global team, and I hope Christine saying, you know, that I think there are lots of resources, and if you don't find what you are looking for in resources, nothing is worth, you know, having a chat with one of the colleagues, and I think the global team remain on standby to support, both from a community engagement, but also more on GBV risk mitigation. So yeah, feel free to reach out, and again, finally, thanks a lot to all of the colleagues that has been involved. Fira, Shadab, Agnes, Christine, and other colleagues, Mary, that have been involved in organizing this event. I think it's great to be able to have this quite important discussion. So maybe Agnes, back to you. I think you wanted to highlight a few more points.
Yes, very briefly, 2 more points. Just to let you know also on this occasion that the Global Cluster is working on a new online training. It's an adaptation of the Interagency Standing Committee GBV guidelines training that will be done specifically for CCM practitioners. We are on it. It's taking a bit of time, but we hope it will be ready like mid-2025. So this will be another resource for the sector available on GBV risk mitigation. And last but not least, and to come back to the point of Olivia on visibility, thank you, Feraz, for putting all the links in the chat too. But so the cluster is conducting a campaign for the 16 days of activism. It started on 25th of November. It's ending on the 10th of December, which is also the Human Rights Day. And we do have plenty of posts every day on all the social medias, and you can follow us and learn more about also the cluster work, partners, field examples, field experiences. So thank you all very much. I'll stop here, and thank you to Christine and the CE Forum for hosting this event. Christine, over to you.
Thanks very much, everyone. We will be sharing the recording on the Community Engagement Forum pages and platforms. I don't know if you want to share it anywhere else, Shadab. He's nodding, yes. I put the link to our website, the Community Engagement Forum website, under the CCM cluster here in the chat. So you can follow that one to get the recording of this webinar. The only thing remaining is to say thank you to everyone, and you're doing fantastic work. Well done, and continue all the amazing work.
Thank
Bye.
you.
Thank you.
Thank you so
Bye.
much. Have a great day. Bye-bye.
Bye.
Thank you. Bye-bye.